Hi everybody, happy Valentine's Day. Welcome to our Sunday TFCC discussion. We're doing a series on all the other things that can cause ulnar-sided wrist pain. Let's see if we can start the discussion about Flexor Carpi Ulnaris, which is something I commonly see. So I'd welcome all of you to call and check in if you want to go over your symptoms, or if you're somebody that has Flexor Carpi Ulnaris tendonitis. So essentially the Flexor Carpi Ulnaris is the main and primary wrist flexor, and it is responsible for pulling the wrist into ulnar deviation. It starts at the elbow. It has a small little thick tendon, turns into a large muscle, and then a tendon about here, and then it goes down and it attaches at the base of the fifth and fourth finger. It's loaded with a grip and a curl, and it's stretched with the elbow straight and the wrist bent. And if you've got Flexor Carpi Ulnaris, it's one of those kind of hard tendonitis structures to treat, and the reason that is because it is a primary dominant flexor, and it's firing all the time regardless of what you do, and so it's really difficult to stop using it and rest it. So the Flexor Carpi Ulnaris symptoms are a radiating ulnar-sided wrist pain. It's more on the palm side of the wrist than it is on the outside of the wrist. People describe it as here rather than the TFCC, which is here. And it's a small distinction that's really important. In really bad cases, you'll see a loss of weight-bearing tolerance, but never really that much. You won't see a significant 30, 40, 50-pound loss in weight-bearing tolerance. What you'll see is a ache afterwards. So when you release the weight-bearing, it'll ache for a while. That's unique to Flexor Carpi Ulnaris. One of the things that it does is it makes your wrist feel loose. So when you shake your hand, it just kind of feels weird when you just shake your hand like this, and it feels unstable, but it's very stable. And there's no change when you put the WristWidget on. The WristWidget probably helps because people with really bad tendonitis, they find that the WristWidget kind of feels stable by compressing it here. You can do the same thing with Kinesio Tape. You don't need that hard WristWidget support, but and you can wrap your wrist with a little bit of KT tape and feel a lot better, that shaking sensation, that stability that you would want for the WristWidget. People who put the WristWidget on, who also have Flexor Carpi Ulnaris tendonitis, at the insertion, they feel that it's achy, it feels unstable, but the WristWidget may irritate it, and that's just because where the WristWidget goes distally here, that's right at the insertion of the Flexor Carpi Ulnaris. So my general rule for treating tendonitis is the first step is to get it pain-free at rest, then pain-free to touch. So when you wake up in the morning, it shouldn't hurt to touch. And if you're there, you can start doing some gentle stretching. Now, we posted some videos of massage, and this muscle gets quite tight with any injury along its structure. It will get tight. So the ball exercises are really good to mobilize that distally and then work on wrist extension. So first step, pain-free at rest in the morning. Second step, pain-free to touch in the morning. Next step is pain-free with gentle range of motion. So if you go through full range of motion with the elbow extended and the wrist extended, you want to be pain-free with that. And usually the delayed pain you want to look out for. So pain that comes on about 20 minutes, that ache sensation you want to look out for. And make sure you tolerate that before you move to the next step. The next step after that, after you have pain-free at rest, pain-free to touch, pain-free with gentle range of motion, is then pain-free with load. So what I recommend is a very small weight and doing some wrist curls with a small weight with the elbow straight, and see how many repetitions you can tolerate. I start with three sets of 15 with a 1 pound weight, and then wait 20 minutes to 40 minutes. see if you get that ache. You want to turn off the use of the hand. And a lot of people, when they're in the first phase of pain-free rest, they put a wrist splint on, and then they go about their day. And when we put electrodes on the forearm and we measure what happens in wrist, we find that the Flexor Carpi Ulnaris is actually firing against the splint. And so oftentimes people say that the splint makes them worse. So you have to be careful with the Flexor Carpi Ulnaris and splinting. I think Kinesio Tape is probably a better way to keep your wrist out of extension if you have pain-free touch. And all you do is you just put the tape here while your wrist is flexed, and every time you extend, you get feedback that you've extended it. All right. Some of the really interesting things about Flexor Carpi Ulnaris in Eastern medicine is that they say that it's related to the heart. And I have to say, from working with the Flexor Carpi Ulnaris Tendonitis for so long, I always recommend a mineral hydration, so electrolytes, because people who have Flexor Carpi Ulnaris that go to acupuncturists, they all consistently say that it's a dehydration or stagnation. And so hydrating with magnesium, potassium, salt are super important. So if you have Flexor Carpi Ulnaris tendonitis, what I would do is I would hydrate daily, be religious about it, and measure the effectiveness of that. You'll find that it's quite effective. Acupuncture works in people that have a really bad injury, so the tendon actually gets weaker. I recommend that cortisone, and you have that for 3 months. Cortisone works really well, but only if combined with rest. So after the cortisone injection, you just got to take it easy and not do much for 10 days. Let that cortisone do its job, and then go through the same thing. Pain-free rest, pain-free to touch, pain-free with range of motion, pain-free with load. All right, anybody can you have a TFCC and an FCU? Yeah, actually, that is more common than not. And the main thing is the splinting. So we don't see Flexor Carpi Ulnaris tears, tendonitis, leading to a TFCC problem. We usually see a TFCC problem leading to an Flexor Carpi Ulnaris tendonitis. And that's, I think, entirely because of the casting and bracing. But you can have a fall on an outstretched hand that affects both. And if you have a fall on an outstretched hand, you want to do the weight-bearing test and define your stability, and define if that stability changes with the squeezing of the distal radius and ulna with the WristWidget or tape. If your weight-bearing goes up, you know that the TFCC is involved. If you have pain to touch at the make sure that gets adequate rest. So rest means you just try not to use your hand. If you're out and about, you can splint it, but take that splint off as soon as you're moving around. Icing really works well. What you do is you take a single piece of ice and you rub it right at the insertion, and what happens with that is that the blood flow drops while you're doing the ice, but then after you take the ice off, you get a really sharp increase in blood flow. So 2 minutes of direct ice onto the wrist really works for Flexor Carpi Ulnaris. It's really hard to stop using it, so your recovery time on these tend to be a lot longer. Just because you start feeling good, you use it, you hurt it, you rest it, you start using it again. And so it's super important to go through the stepping stones of treating that Flexor Carpi Ulnaris. And if you do it and you do it right, it should resolve very quickly. It's a highly innervated structure. It heals really fast. It's very, very strong. So if you take care of it early and you take care of it right, it'll go away. So e-stim also helps. Doing some electrical stim, ultrasound helps. Phonophoresis, iontophoresis, which is basically cortisone, helps. But it's not just here. You got to address the muscle. The muscle gets really tight, so you have to mobilize that muscle and keep it elongated. Kinesio Taping helps to kind of prevent the side effects from the wrist splint. And TFCC tear, then the Flexor Carpi Ulnaris. I'm just answering Lewis's note here. TFCC, yeah. So the Flexor Carpi Ulnaris has an important contribution to the stability of the wrist. And so, it's secondary to the TFCC. So if you have a TFCC tear that's significant, the Flexor Carpi Ulnaris, strengthening it or using it is not going to change that TFCC. So in this situation, the TFCC is first. You have to take care of that first. You have to get stability of that first. And you can do that without splinting the wrist into a hard wrist cock-up splint or a cast. And measure it really carefully. So when you get to that 45-pound landmark of stability in the wrist, you'll notice that a lot of the tendons and muscles of the wrist start to calm. But if you're somebody that was casted for a while and you developed Flexor Carpi Ulnaris Tendonitis, it really does require a daily management. You've got to think about it when you wake up in the morning and take care of it. It doesn't take much time, but you just have to think about it, take care of it till that pain at rest, pain to touch, pain with gentle range of motion. The other thing that's important is that TFCC tears don't ever cause problems with wrist flexion and extension ever. It's really a load and rotation and weight-bearing injury. So if you've got issues with flexion and extension and you have palmar flexor tendon, Flexor Carpi Ulnaris tendon pain, it's right here. It's super easy to feel. It's a very thick tendon. You shouldn't have pain to touch on that structure. So it's, in that sense, it's pretty easy to measure pain at rest, pain to touch, pain with gentle range of motion, and pain with load. So the weight-bearing test is a good way to kind of see how you're doing as well. Okay. If you have pain with range of motion. All right, so I'm assuming that your first thing I want to know is, what is it, wrist extension that you have pain with and end range flexion, and does it get worse with the elbow extended? So you want to start in your stretching around the wrist. My thumb on the injured hand has been feeling numb, like the blood is starting. It's in at the top. Oh, okay. All right. So there is a median nerve that goes here that often gets irritated by the Flexor Carpi Ulnaris. So, and that goes to the tip of the thumb. And usually it's a little bit distal. So it's about here, distal. And when you push on that, I want you to push on that. Tell me if the tip of your thumb numbness gets worse. If that's the case, you can really have some great influence with Kinesio Tape. So, all right, nerves kind of are the primary of all things. So on the hierarchy, without the nerves, you don't have a lot of things. So when you have nerve symptoms, you have to take those as first. Ligament is second, tendon third, muscle fourth. So if you're having nerve symptoms, you want to address those first. So I hear what you're saying is that when you stretch your wrist into extension. Okay, so what I'm going to show you real quickly is some things you can play with Kinesio Tape. So if you've got some Kinesio Tape, the first thing I'd like to know is what happens if you pull the skin at the wrist towards the thumb. Does that make the thumb symptoms go away or improve, or does it make it worse? It should make it feel better. If that's the case, then you just take the tape, you place it on here, and you pull it. You pull the skin to hold that tension. That takes the tension off at the superficial nerve and should help with your symptoms to the tip of the thumb. And you want to leave that there while you're doing your exercises. Okay. All right. Alison Taylor is a wonderful resource for kinesio taping questions. Kinesio taping is something that I really like because it serves an important function. It's really tricky to teach somebody over the internet how to kinesio tape because it's very specific and unique to you. So what you want to do is you want to try kinesio taping and essentially try to stretch the skin in different directions. So you go this way, you go that way, you go this way, and you go this way. And find how what influence stretching of the skin has on your symptoms. And once you find that, then you use the tape to hold that. And that's essentially the skinny on Kinesio Taping. And it works really nicely in the wrist, especially with Flexor Carpi Ulnaris Tendonitis, because you can't splint it. Oh, good. Yeah, Lewis, that's right. That's right. Okay, good. Like I said, the TFCC is kind of easier than the Flexor Carpi Ulnaris. Go and get yourself on some electrolytes and do that every day for a good 7 to 10 days. Just drink and drink and drink to help that out. When you're doing the stretches, if you're getting nerve symptoms, address the nerve symptoms with the Kinesio Tape first, and then do the stretches with the Kinesio Tape. Yeah, right. Okay. All right. So, Lewis, can you confirm that you have numbness? Because Andy's got the numbness. Lewis, can you tell me if you have any numbness? And I'm assuming, Lewis, that your weight bearing is good with no delayed ache. Okay, all right. So before you go from 0 to 60 and get back into the gym, there are some stepping stones that you need to do before you do that. Dull. Yeah, okay. All right. So wake up in the morning and measure pain at rest, pain to touch, and then get yourself some minerals and maybe go for a good walk. Take a piece of ice it, heat up the forearm, and do some deep tissue massage, and then you're going to go through some stretching exercises. So you don't want to be loading the wrist until you can tolerate full range of motion without any problems. And so the stretches that we gave are the wrist extension in the different positions. You want to be able to tolerate that well before you load it. Then you go into, you're able to tolerate that full length and tension onto that Flexor Carpi Ulnaris. Then you start with strengthening exercises. First, I start with grip. So just squeezing something. I use the squeg. You can use a tennis ball. Anything. Just start squeezing and contracting the muscle here. Nice, strong contraction and release. And then squeeze again. Nice, strong contraction and release. And I do it with the elbow straight. So feel that here, it's not on a stretch. You're just taking the muscle and you're firing it. Do that 15 times, 3 reps after you address it. And if no problem, then you can move to the next step. The next step is wrist flexion with load. So you take a 1 pound weight and you, with the elbow extended, you curl your wrist like this. Same thing, 15 reps, 3 sets. Measure how it tolerates that. If it doesn't tolerate it well, back off 1 step and just do isometric until it, and then treat it with ice and do everything else. Then move to the 1 pound, and then move to the 2 pound, and then to the 3 pound and 4 pound and so forth. But you don't want to go to the gym and pull a 50 pound load when you haven't gone through the first steps. So you're basically tugging on the rope of your Flexor Carpi Ulnaris and making sure that it's strong enough to tolerate that load. And you've got to train that muscle to work normally again. And so the muscle gets weak and it'll get strong really fast if you're ready to go. But it'll also re-injure itself if you go from 0 to 60 too fast. So you just go slow, nice and easy. Every day you do it doesn't take much time. You just, again, is it painful at rest? Is it painful to touch? Is it painful with range of motion? Ice it, drink electrolytes, heat the forearm, do some rolling exercises, do some stretching, and then do some strengthening. It takes about 15 minutes to go through that whole program, and you'll get from point A to point B faster if you kind of follow those rules. Yeah. Okay, so definitely don't want to be going to the gym and doing load in a wrist extended elbow, this position. Definitely don't want to be doing that. You don't want to be stretching the tendon and then loading it the muscle excessively. You'll pull on that. It's really simple. If you take a structure and you bend it here and you pull on it and it's not ready to tolerate that load, you're going to get a breakdown here. So go easy first, take the steps, and then off you go. And don't get frustrated if it comes back. Now, if you're somebody that has a job that you have to, or you're an athlete and you have to perform, you don't have the luxury to rest your wrist, cortisone really helps. But just remember, cortisone is there to address the inflammation, and it doesn't address the underlying issue. So even if you have cortisone injected to speed things up, you want to follow the same protocol. Rest it if you can. Don't splint it. Every morning ice, all of that stuff. Keep doing that. It'll shorten the recovery time, but if you don't follow that recovery protocol, it's just going to be chronic, even though you had a cortisone injection. The main thing for chronic flexor carpi ulnaris, if you're in the gym, is to keep the wrist out of wrist extension, and you can do that with taping. So you can do it with Kinesio Tape, but essentially what you're trying to do is take tape, wrap it a little bit distal to the wrist crease, and go 2 or 3 times so that you get a buildup of and it limits your wrist extension. You can use hard tape like athletic tape, or you can use wraps, which are helpful to keep you out of wrist extension. But you can't do heavy load. You've got to stay away from the heavy load, just plain and simple. You can go to the gym and do all kinds of things, just not that load. There's certain weights in the gym are probably free weights with bars. That usually is the culprit. All right, let's see here. I think I covered everything. If you've got ulnar-sided wrist pain, let's see if there's any more questions, let me know. Andy, make sure you take care of that nerve. Pain with range of motion, we talked about that. I think I got all the questions answered. Otherwise, you guys have a really nice Valentine's Day, and we love you, and send your questions. Next week we're going to do gut, the correlation between the gut and the TFCC, so stay tuned for that. I also want to let you guys know that of all the electrolytes that I like the best, the Remag mineral liquid supplement is fast to absorb and will get minerals in you. The other one is the salt minerals in a bag. They're dried minerals that you just put in water. If you don't have access to that, then I would make sure you get a little bit of some bananas and some salt in your water when you exercise. But stay hydrated when you're exercising. And let me know if you have any questions. We're here to help. But happy Valentine's Day. We'll see you next week. Bye.